Was assisting with open gallbladder removal. When it was time to close the surgical wound, we did our count of instruments and sponges and found a sponge was missing. We counted, again and again, still missing. I reported this to the surgeon and asked him to check inside the wound and around the organs for the missing sponge. He refused, saying he had kept an eye on all the sponges and the missing one probably fell under the drapes. I told him calmly that our count was off multiple times. It was a big sponge so it couldn't just slip under the drapes, and if he closed without checking, I was going to order an x-ray. One of the times an RN could order an x-ray without a doctor's signature, to check to see where the sponge was. Grumbling about how we were wasting his time, he stuck his hand back into the wound, fished around and pulled the sponge out from behind the patient's liver. Had the sponge stayed in and I called for an x-ray, it would have meant extra anesthesia time for the patient, and had he closed before the x-ray was done, the wound is reopened and closed, so a nastier scar and increased risk of infection. Had I not called for an x-ray and the sponge remained, it could mean serious infection and suffering for the patient. 6. I wasn't the primary nurse, but working with a nurse who prevented a serious error. We had a patient who was admitted for abdominal pain.